And we're going to begin with that major shakeup at the highest levels of Ontario's COVID-19 response team. The province says Dr. Williams will retire on June 25th. Now, he was set to leave his post months ago, but had renewed his contract earlier this year due to the pandemic. His departure comes as the third wave has begun to subside. Dr. Kieran Moore, the Chief Medical Officer of Health for the Kingston area, has been named as his replacement. Well, Dr. Williams has been in the role for 5 years, and at times he has faced calls to resign over his handling of the pandemic. Laura McQuillan has more.
Critics have called for David Williams' ouster as Ontario's top doctor for several months, and now he's out, but the reasons why remain unclear. Williams was set to retire back in February, but the provincial government extended his term until September. Throughout the pandemic, Premier Doug Ford has praised Williams for his work, even as other medical experts criticised the doctor's communication style and his advice to the government around restrictions. But more recently, Williams and Ford have been at odds on the issue of school reopening. Williams has said that it is safe to reopen schools now for the end of the school year, but Premier Ford has written to other public health experts asking them to weigh in with their opinions, an unusual step in the province of Ontario. In a media release, Ontario's government said Williams will be replaced by Dr. Kieran Moore, who's currently the medical officer for the Kingston region east of Toronto. That region has been hailed as a pandemic success story, with just 1,500 COVID cases and only 3 deaths throughout the pandemic. And Moore has been credited with taking early action to prevent COVID in his community, like bringing in a mask mandate weeks before the provincial government did the same. Moore will begin working alongside Williams in a week's time before Williams officially leaves the role on June 25th. Ontario's government hasn't given any reason for his departure, but it said that Moore's public health experience would be, quote, crucial as Ontario begins rolling out second doses of vaccines and prepares to reopen. Laura McQuillan, CBC News, Toronto.
For more on this development, we have reached Dr. Jane Philpott. She's the Dean of Faculty of the Faculty of Health Sciences at Queen's University and has worked closely with Dr. Kieran Moore. Dr. Philpott, thank you so much for making time for us.
My pleasure.
Okay, Dr. Philpott, I'm going to read your own words back to you, your own tweets back to you, because you were feeling some emotions, clearly. Yesterday you tweeted, "This is bittersweet news." You said that you're not sure you've met anyone with as much compassion, energy, and brains as Kieran. It's a huge loss for Kingston, but honored to share him with Ontario. You also went on to say you weren't sure if you should cheer or cry simultaneously. All right, that's a lot of emotion, Doc. Tell me about Dr. Kieran Moore and what makes him so great.
Well, as I said in my tweet, I've met a lot of exceptional people in my life, but with Dr. Moore, it's this incredible combination. He's a brilliant leader and thinker. He moves at the speed of lightning in the way that he thinks and moves, but he has a heart of incredible compassion and a desire to do good. You put all that together in a package. Honestly, you could not have a better person as the Chief Medical Officer of Health for this province.
Have you had a chance to speak to him about this?
He and I texted last night when the news had broken, and I certainly wish him the very best, and we will be here to support him in any way we can. Of course, all of us in the Kingston, Frontenac, Lennox, and Addington area are pretty sad to see him go, but when you've got somebody great like that, you can't hang on to them. You have to release them to do even more good in other places.
Well, what's your sense of how he's feeling? Is he cheering or crying?
He is I would say, the classic public servant. He went into medicine and public health, I think, to serve people and to make people's lives healthier. I don't imagine he's, like any of us, wanting to do more work or work harder when he's already working as hard as he has been. But you know what? The call comes and there's a requirement to serve your people. And he's the kind of guy who will just say, I'll step up if I'm needed and I'll do what's necessary.
What do you think are going to be the biggest challenges he'll face once he steps into that role?
Well, I think there's some sense that, the worst is behind us. But in fact, I would argue that there's even harder work ahead, right? So yes, the numbers are going down, but we need to sustain that. There continue to be variants of concern. And Dr. Moore, the other way that I didn't put in Twitter last night, but I've been thinking about it since, he's like the Wayne Gretzky of public health. He sees where the puck is going. And so that's why he's such a key person in this regard, so that no one wants to see a fourth wave come along. And he's the guy that can help us look for the right kind of indicators and make sure that doesn't happen, but also set us up well for the huge challenges ahead in terms of preparing for future potential pandemics, and also addressing the great population health needs that we are facing because of the impact of the last 18 months.
What do you think of Dr. Williams' performance in the role?
Well, Dr. Williams has had an incredibly difficult role, and I really wish him the very best in retirement. He's probably not had a moment to catch his breath over the last 17 months, and so he has deserved a well-deserved break. He should be thanked for his service to the people of Ontario, and it's time for him to catch his breath, spend some time with his family, and we're ready to move into the next phase of leadership.
Dr. Philpott, you're a medical expert, certainly, but you also have had much experience in the world of politics, and many are talking about that this morning with this story. That was this a political move? Was he pushed out because he didn't fulfill the role he was expected to, or at least to the degree that he should have?
So I'm going to take another line off of Twitter. One of my colleagues last night from here at Queen's said, two things about Dr. Moore, and I'll get back to your question in a second. Dr. Moore always thanks people genuinely for the work that they do. And number two, he never blames or shames people for the outbreaks that happen. So I'm going to take a lesson from that and say, as it relates to the hard work of Dr. Williams over the last 17 or 18 months, he deserves our complete thanks for the hard work that he has done. And nobody can say that they would have done any better in the same kind of circumstances. It's time for him to take his overdue retirement, and we'll look forward to the work ahead under new leadership.
Dr. Jane Philpott, I want to thank you so much for your time and for your insights today.
Thanks for having me.
Dr. Philpott is the Dean of the Faculty of Health Sciences at Queen's University.